I am a rising senior at Chapel Hill High School, and my group, we are studying antacids, so H2 blockers and proton pump inhibitors, and their effectiveness as GERD treatment in infants.
I'm a rising senior at Riverside High School, and this summer I studied gastroschisis, which is a condition where infants are born with an underdeveloped abdominal wall, and so their intestines are exposed at birth.
I'm a rising senior at the North Carolina School of Science and Math, and my group is studying granulocyte colony stimulating factor, which helps with the development of neutrophils, and specifically how it will help prevent babies from getting infections.
Welcome to the North Carolina Collaborative Summer Research Experience Program. This is an 8-week program for high school students, college students, and teachers from Durham County and Orange County who would like an experience in clinical research over the summer. The program exposes students to a broad basis of skills. We teach the students concepts around neonatology, the care of the premature infant, pharmacology, statistics, epidemiology, and clinical research good practice.
The way we did research this summer was we looked at records of how babies had been treated, that way their physicians thought was the best way for them to be treated. And we analyzed that data to try to figure out which treatment was most effective so that can help influence the decisions of physicians in the future and create the best treatments for the babies.
H2 blockers and proton pump inhibitors are often prescribed to adults. However, there isn't enough information out there about using these antacids in small infants.
The students work with real data from our clinical research projects from throughout the world. We teach them how to do this, not only the science, but also how to publish in the peer-reviewed literature. And in fact, our students who are graduates of the program have published their results from prior summers in peer-reviewed journals.
The program offers a stipend in order to make the program accessible to anyone, including those who had planned to be working over the summer. When they start the program, their impression of clinical work and clinical research is based on TV shows like ER. But after this program, after they've had the opportunity to interact with clinicians and clinician scientists, they have a more realistic view of this field.
I've learned a lot about everything and everyone that goes into producing a fully published research paper. We learned about informed consent and what it was and why it really is important to respect the wishes of the patient who is going to be acting in clinical studies. And we toured the Duke Hospital, and we got to see the pediatrics ward. We got to see the stimulation lab, which was, I thought, the coolest part.
I went on a trip to a lab that was studying fungus. I was really interested in how passionate he was about it, and how much he really liked working with this fungus. I really liked him talking about the kind of research he did and the process, even if I wasn't interested in the fungus itself.
The most awe-inspiring part was the people, definitely. I mean, the people, so many interesting people from various different backgrounds, and just hearing their unique story and how they came to medicine and how they embraced change in their life. Seeing that and them finding their passion was just really inspiring.